I have to ask you this before I go. Now that you've, because that's one of the questions I wanted to ask and I completely forgot because we, veered off on all of these different tangents.
Yes.
But crystal meth, drugs, and psychedelics, and the link between them seeing these beings or entities.
Yeah.
What's your understanding of what's going on? Is it that the drug or the substance is opening up a part of the brain, which is then opening up the part of the mind, which can access these things? Or is it that, I don't know, that is it just pure hallucinations that people are seeing? But that wouldn't explain the sort of common things people are witnessing across the world. Or is it something else? How do you explain it? What's your understanding of it?
It's very, very interesting. I think in a brief way. So things like heroin, people who use heroin or opioids, they don't report these kind of experiences. People who are using, say, alcohol, they don't report these kind of experiences. What I've noticed from my clinical practice is, and now this is a big issue, is crystal meth, so methamphetamines or stimulants. And things like hallucinogens, ayahuasca. You might have seen stuff about ayahuasca in Latin America, people going and having this bad trip and reporting these really scary experiences. So I've seen a lot of patients using specifically crystal meth and reporting quite common experiences, even mentioning jinn and even mentioning qareen. I had a very interesting experience where I was assessing a patient and he was telling me, right now my qareen is communicating with your qareen and telling me what you're thinking about me. Subhanallah. And the thing is, as psychiatrists, we're able to elicit whether somebody's having a hallucination in the sense of a mental disorder or whether there's something else going on. So I'm not sure, to be honest. I think this is an area of research. I was speaking to Ustad Tim Hummel about this because he's come across this as well, that specifically methamphetamine, crystal meth, there's something that opens up the mind where people report seeing some jinn and these kind of like other beings.
So in this week's episode, we have a phenomenal guest on, Dr. Abu Isa, who is a consultant child psychologist specializing in addiction. We dive into the world of mental health, anxiety disorders, depression, and so much more. Furthermore, we also look at the connection or relationship between the physical and the metaphysical when it comes to psychology. The link between mental health and the world of the jinn. It's going to be a fascinating episode, brothers and sisters. So without further ado, let's get on with today's episode.
Bismillah, alhamdulillah, wassalatu wassalamu ala rasulillah, assalamu alaikum. Jazakallah khair, Imran, for inviting me. It's an honor. I have seen some of your stuff previously and obviously follow Sapiens, and I've done podcasts with Hamza Zorzes and Gabriel Romani and etc. So Jazakallah khair for reaching out. It's an honor to have a discussion with you today, inshallah. So in terms of answering, maybe I'll just give some background to my professional kind of education. So brought up in Newcastle, northeast of England, went to Oxford for medical school, and then I actually started training in orthopedic surgery, and then I switched to psychiatry. So that was interesting. Wow. So then I trained for 6 years in Manchester. I'm actually a child and adolescent psychiatrist. Worked for 2 years in Bury in a private sector, and then I went to Qatar to set up a addiction service for young people. Was there for 8 years, and I moved to Dubai a year ago. So I'm currently in Dubai, head of the addiction service for South London Maudsley Hospital here in Dubai. In terms of answering your question, so obviously, alhamdulillah, I was brought up in Saudi when I was younger, so I always had an interest in Islam, and Allah guided me from a young age. So one of the reasons I came into psychiatry was to look at the interface between the Western concepts or Western paradigm of psychiatry, psychology, and the Islamic concept of jinn possession or the ghaib or the unseen. So this was something in the back of my mind. And then when I was training, I had the opportunity to work with some mashayikh in Manchester, and then a big sheikh in Qatar, Sheikh Hazim Rajab, who's American Egyptian. So because I had the kind of secular understanding of things like psychosis and, which is most commonly overlaps with jinn possession, I started working in tandem with the mashayikh to do like holistic assessments of people in my own time with the sheikh, to provide both a spiritual kind of assessment plus also a kind of Western psychiatric assessment. And then being from Newcastle, I'm a good friend of Ustad Tim Hummel. So Ustad Tim Hummel is also currently in Dubai. So he and I work closely together. We collaborate in terms of, because he gets a lot of families who contact him with queries about jinn possession, ain, or black magic. So we work together, again, similarly, doing assessments together. He always refers people to me first because he is a strong believer in excluding mental health issues before delving into kind of like, the unseen and things like that. So that's kind of a brief summary how I got involved in this kind of work.
Very interesting. So, I mean, one of the very first areas I want to sort of, I guess, because we've opened it up already, get into with you is this whole dynamic between these two different, in some regards, opposing worldviews or ways of understanding reality. You've got the secular paradigm, which obviously is dominant today, and it has a certain way of looking at reality and understanding the world. And it's based on certain fundamental principles and ideas, right? So, such as the idea that all that exists is the physical material world. If you look at it from the perspective of naturalism, there's nothing beyond the physical material, and therefore methodological naturalism comes into it, that everything therefore requires a naturalistic explanation. And I'm sure that sort of broader principle within science transfers over to psychology as well, that you have to look for natural causes behind mental illnesses and so on and so forth. So that's one paradigm. And then obviously you have the Islamic paradigm, which recognizes, I guess, the psychological or the physical aspect, not necessarily purely physical, but mental aspects of certain conditions, but also the metaphysical, the unseen, the jinn, etc., that play into this whole mix. So how do you, in your experience, how have you tried to square this circle? How do you bring these two different opposing worldviews together in your practice, in your work? Tell us something about that.
Yeah, alhamdulillah, excellent question. So one of the beauties, actually, even people might not know, even within the secular or Western framework of psychiatry, so you have two classifications we use, something called the ICD, International Classification of Diseases, and DSM, Diagnostic and Statistical Manual. So those are basically diagnostic classifications we use to diagnose mental and behavioral disorders, right? So within these diagnostic classifications, they get revised quite regularly. So currently we're on the 5th version of DSM and 11th version of ICD. Within that, you actually do have a classification of disorders, including possession states. So they even atheists, who are usually the ones who formulate these diagnostic classifications, they recognize the spiritual aspect or the unseen aspect. So many cultures, Latin America, Christianity, obviously Islam, they recognize that there's a belief system. So they recognize transpossession states. Also something called conversion disorder. So conversion disorder is basically the Western understanding is somebody goes through severe trauma and then they manifest physical symptoms. So people go blind or people become paralyzed, but there's no organic or medical cause identified. Yeah, exactly.
Which so are they referred to as psychosomatic states?
Psychosomatic, exactly.
Somatic expressions of those psychological states.
Exactly, psychosomatic or conversion disorder. So I think we already have a recognition within the Western world of kind of, some of the unseen kind of things that can happen. And interestingly, if you look at the definition of a delusion, it's basically an abnormal belief which is unshakable, which is out of context with the patient's cultural or religious background. So I worked in the UK for a long time before I moved to the Middle East. So even within my multidisciplinary team, people knew what jinn were and what jinn possession was, and for example, cupping. So we use like a biopsychosocial spiritual model. Obviously it's quite limited in the sense that just having that understanding and insight is helpful. But in the Muslim world, alhamdulillah, for example, now where I work in Qatar and also in Dubai, we have a sheikh. So we incorporate spiritual counseling as part of the treatment plan. So for example, they pray salah regularly, they have halaqat, they have hadith classes. And those are incorporated into the treatment plan for the patient. And those are very protective factors for obviously Muslim patients. So then moving on from there, in terms of you're saying squaring the circle. So already we have an advantage in mental health because it's very subjective. As you know, if you have two psychiatrists, they may disagree on a diagnosis. So it really depends on how much of a relationship you develop with the patient therapeutically and how you're able to elicit symptomatology and how you're able to articulate what the patient is experiencing. Both within kind of the Western framework, but also an understanding that the culture and religion plays a part as well.
So when you say that the sort of secular world understands or acknowledges some of these or some aspects of the metaphysical, maybe not as a reality, but as a framework. So say they they come across someone that comes from a Muslim background. They know this person has beliefs about the jinn, and therefore what they express as far as their symptoms and states are concerned, that may be a psychological manifestation of their beliefs. Is that how they understand it?
Yes, exactly, 100%.
But
100%.
but fundamentally, they are not saying what they experiencing is actually jinn or the unseen or spirits, but what they're experiencing is a psychological condition. But they are interpreting it through their sort of framework of understanding.
100%. Obviously, most of the colleagues I worked with, either they're secular atheists or Christians. So yeah, they don't believe that actually what the patient is experiencing. For example, if somebody says, look, I think I'm seeing jinn or there's black magic issue, they recognize the terminology or the language, but obviously they don't believe it, which is the difference between Muslim psychiatrists. And actually, Imran, what's interesting is I've come across Muslim psychiatrists who also are very, let's say, resistant to believe in the unseen. So I've had a lot of debate and arguments with colleagues who basically don't believe in, for example, jinn, or they don't believe in black magic. And usually these people are quite secular. And so I think that's why it's really important for Muslims, practicing Muslims, to be involved in this field, because there's a strong need. I'm getting like almost on a daily basis contacted because of my social media kind of work. Through YouTube and etc. and Twitter or X, people contacted me, asking for help. And these people would not access help because when they go to a psychiatrist, even a Muslim psychiatrist, say in the Muslim world, many of them just kind of don't believe in the unseen. So they feel kind of that they're not going to help them.
Yeah, it is fascinating, isn't it, Doctor? Like normally you would see people in the West more open to these ideas. And sometimes you find in the Muslim world, the secular amongst the Muslim to be much more extreme in their sort of denial of these realities. And it's unfortunate. Obviously, there's reasons behind that. Maybe we can go into that later on. So you mentioned that you come across a lot of people that contact you because, they've come across such gone to see such individuals and they haven't found it to be very helpful. Moving on to your sort of again, feel as comfortable as you are discussing these things. If we don't want to get into certain topics, we don't have to. But when someone comes to you, I guess the next thing I'm trying to get into is, do you have a process in place or some sort of guidelines or advice you can give for people to differentiate? Because there is a lot of confusion in regards to these, between, is it a psychological issue that I'm experiencing, a mental health issue, or jinn? Or the unseen, and it is a very difficult topic because you're dealing with the unseen. So there's only so much you can know about the unseen. But from your experience, is there a way, or is there things that you share with people, some sort of criteria to sort of help determine what they're actually going through?
Yeah, again, mashallah, excellent question. So there's no hard and fast rule. Obviously, I have my experience through my studying and clinical experience. I generally divide people into three groups. So there's a group of people who purely have a mental disorder. There's no kind of unseen issue there. Okay, things like, for example, schizophrenia or severe depression, or say bipolar disorder, as an example. Then you have a group which have purely a spiritual issue and there's no mental illness, okay? And then the vast majority of patients are in the middle, where they have both a kind of psychological, psychiatric issue, plus also an unseen issue. Because if you have a mental disorder, you're very vulnerable and you're more likely to be attacked by, say, shayateen or jinn. And similarly, if you're attacked by shayateen or jinn, you're more likely to suffer from a mental disorder, right? So the vast majority are kind of like in that middle group. And this is just something that I've formulated in my own kind of practice. It's not something that's, research-based or evidence-based in terms of published literature. Something I'm thinking about. But so broadly speaking, those are the three categories. Now, in terms of differentiating is very, very challenging. Often it requires long consultations, plus help from a shaykh as well. To give you like an example, somebody who speaks a language they've never spoken before, okay, that's not a mental illness. That's most likely an issue with jinn. So I'll give you an example. I had a friend in Qatar, and he was asked by the same sheikh I mentioned, Sheikh Hazim, to go and meet a family, a couple, American revert couple, who were having some issues. So the husband was complaining that his wife was having some personality issues, anger issues. So my friend, he went there. His name's Imran. He went there and he started. He introduced himself and he told the couple, "Look, I'm going to read some Quran. If there's any issues," he told the husband to please, like, restrain the wife because he's not allowed to touch his wife, for example. So he started reading Quran, and what happened after a short while, his wife, she started like making strange noises, right? Like hissing and kind of making inappropriate postures. And then, so it's quite confusing for him. So he continued to recite Quran, and then suddenly he heard a male voice speaking Arabic. Okay, so this couple, they don't speak any Arabic. So when he looked up, the male voice was coming out of the sister. And he knew fluent Arabic, so he started conversing, and this was actually a jinn. So the jinn had possessed the sister, all right? So he continued to recite, and she tried to attack him. So, the husband was trying to restrain his wife. And then after a short time, he heard another male voice in speaking Arabic, and he looked up, and the husband was also possessed. So now he had two individuals, subhanAllah, speaking Arabic and, trying to attack him, subhanAllah. So he's like very scared. This is the first time he came across anything like this. He works in education, so he has no clinical background. And then they both start to attack him, and he does Brazilian jiu-jitsu, so he was like punching the husband and like kicking him. And at one point he got really almost became overwhelmed, so he's like edgeless, and he kicked the guy and he went flying across the room. And then they settled. Then he started conversing with them, and they said that there's some magician in India, and he wanted to cause problems for the couple, so that he sent two jinns to possess them. So anyway, he had this discussion with them. They refused to initially leave, and then he continued to recite. Obviously, Quran burns the jinn. So then they agreed to leave through the eye, and he said, no, it will damage the eye, leave through the feet. Before leaving, they threatened him, and then they left. After a couple of minutes, both the husband and wife, they couldn't recall anything that had happened. And the husband's like, "Oh, I've got some pain in my ribs." He said, "I'm really sorry I had to, basically punch you a couple of times because you're trying to attack me." So now, if just a description like that, right? There's no clinical psychiatric explanation for this. Okay, there's no disorder that will explain this. This couple who don't speak a word of Arabic are now speaking fluent Arabic. Okay, and then they have no memory of it. So to give an example, that's clearly a spiritual unseen issue. There's no mental health issue in that scenario.
Okay, so that's very interesting. So what you're saying is one of the differentiating factors is when something is displayed which doesn't make sense naturally. Like, for example, someone that doesn't know a language and then speaks in that language fluently, there's no natural explanation for that. Is there something in the literature in regards to where psychologists have tried to explain this phenomenon? I mean, is it something that's appeared in the literature, and have people tried to explain it?
There is some. It's very limited, to be honest, Imran, but it's mainly from Muslim sources or say Christian sources. The problem is that, like, now I'm describing a situation, so most secular psychiatrists, they wouldn't believe that this actually happened. So it's difficult because they haven't been exposed in real time to these kind of experiences, so then they're not able to validate it. You know what I mean? So that's the issue. If you could get a non-Muslim or secular psychiatrist to be part of the team to observe these kind of phenomena, then possibly they might look at putting that in the literature. The closest thing is near-death experiences, NDEs. I think you've come across that in your work probably, where there's a lot in the literature where they've done research studies where people are basically brain dead, and they report kind of seeing themselves undergoing treatment. So that's probably what I've come across as the nearest thing as a metaphysical experience where they've tried to explain it in the literature. But in terms of like possession states, more probably from Christian sources rather than other sources.
Interesting. Have you seen the telepathy tapes or come across them?
Yeah, I've come across them. Yeah.
Yeah. Again, very interesting phenomenon that's taking place. Obviously, there may be one could come up with a few different explanations as to what may be going on. But what's your what was your sort of assessment of that phenomenon where these autistic children were able to almost read the mind of the parent, the mother or the child, mother or the father, with numbers. So they'll have to be looking at a certain number, and the child had no access to it, yet they will be able to predict it or say what number it was.
Again, it's very fascinating. There's different hypotheses. I mean, you could potentially hypothesize that kids who have autism, because there is some belief amongst the mashayikh that autism is a spiritual issue and it's related to the unseen, and they don't believe it's like a neurodevelopmental issue. But then I think the vast majority of the mashayikh that I've come across, for example, Ustad Tim Humble and other people, they do believe that this is a neurodevelopmental issue and it's not kind of a jinn or a black magic issue. So these kind of kids with autism, they have, subhanallah, a lot of resilience and a lot of strengths. Now there's a spectrum, right? So there's kids who are non-verbal all the way up to high functioning autism, Asperger's. So I'm not 100% sure, like with the telepathy thing, which kind of autistic kids they were kind of using. But you could hypothesize that they have like this connection with their parents, which is considered like a super strength, and that they might be in tune with their parents to a higher degree than, say, kids who are not autistic with their parents. Or it could also be an unseen issue. As you know, we have qareen, right? So every individual has a jinn accompanying them, and if you go to people who use black magic, they often connect with your qareen, so they're able to gain some personal information. So potentially you could hypothesize some of these kids may have access to the qareen of their parents, and they're able to access information which nobody else would
That's
believe.
very interesting. That's very Ibn Taymiyyah, I think, in his essays on the jinn, he mentions examples of where the jinn will be in touch with certain Sufi masters, and they would get certain information and bring it to them, and then they'll pass over some information to their followers and so on and so forth. So
exactly,
when you mention the qareen, just for the viewers, what you're referring to is the jinn that is assigned to every single one of us individually. Now, just to sort of speculate on that a little further, obviously the qareen knows your psychology very well as an individual. He knows what your strengths and weaknesses are, what affects you, what doesn't affect you. Now, coming sort of a step down from sort of full jinn possession and psychosis for a moment, the more subtle types of mental illnesses, say where someone's experiencing intrusive thoughts or has some sort of anxiety condition, where certain thoughts keep coming in their mind and they become obsessive compulsive about them. Do you think does that phenomena fit into that middle category where there's some aspects of psychology and some aspects of the metaphysical coming together?
I think you're spot on there. So the condition that the most commonly I come across is obsessive compulsive disorder. So patients, basically, for people who don't know what OCD is, people have obsessive either images or thoughts, and they often have accompanied by compulsions. So compulsions means actions that they have to do to reduce the anxiety associated with the obsessions. So I do believe what you're saying, Imran, is that some of these obsessive thoughts, especially the religious content. So I recently have been working with a student of knowledge in Medina. He's the son of a friend, and subhanallah, he's now, I think, in his final year. So over the last 6 to 12 months, he's been experiencing quite a lot of obsessive thoughts. And obsessive thoughts or ruminations can have different categories. Most commonly we see around symmetry, for example. So some people need to like switch the light off 2 times, 4 times, 6 times or whatever. Then also checking. So making, they have doubts whether they've locked the door, or so they may be spending like 20 times checking if they've locked the door, or contamination. So excessive hand washing. That can then tip into religious content in Muslims. So things like wudu. So people often spend hours making wudu and repeating it because they think they've broken it. And I think in that situation, definitely the shayateen are messing with the individual's mind, creating doubts, because that has a religious impact, right? So for example, if you keep worrying whether you've got wudu or not, that's going to affect your khushu in your salah. So you could hypothesize that in that individual, yes, they've got like a biological, psychological issue, OCD, but the shayateen are taking advantage of that situation and making the person doubt from a religious perspective. So this brother, young brother, he has a lot of issues where he thinks that he's left the fold of Islam because of something that he's done. All right, he knows logically that because he's a student of knowledge, that whatever situation scenario he's described doesn't take him out of the fold of Islam, but he's getting these intrusive thoughts that yes, you're a kafir, and you need to leave kind of Medina University because you're not good enough, etc., and you're not a Muslim. So in that situation, I think he has an issue with both the biological, psychological issue plus the jinn issue.
So what would you advise in that sort of for those individuals experiencing that? What sort of general advice would you give them? And the reason I asked, Doc, is because we do something called lighthouse mentoring at Sapiens as well, where we get, an hour-long one-to-one session with Muslims who have doubts, etc. And the most common thing I've realized, I would say 95% plus of people that come on, they are experiencing some form of OCD or intrusive thoughts in regards to their deen, questions about faith, etc. And you could tell, as you speak to them, you pick up on those traits that they're constantly worried about things. Thoughts are going on in their minds. Am I a Muslim? Am I praying properly? Sometimes they're overwhelmed. Sometimes they repeatedly are engaging in studying certain topics even and becoming obsessive about it, like arguments for the existence of God, and they'll become obsessive about it. And then when they look into it and they understand something, they get this relief and they feel good for a moment, and then they go back into it. And if they don't, then they get really anxious and frustrated. So I guess referring specifically to that category in between psychology and the spiritual, what advice do you give such people so they can start helping themselves?
Excellent question. I think for OCD, it's very difficult to treat. Okay. I would go from first principles that the person needs to get psychiatric assessment and help, because what happens is the severity of OCD, if it's left untreated, can become quite resistant and then can expand into other areas. If you speak to kind of the individuals or brothers and sisters that you're mentioning through the mentoring, if you track back their timeline, I would guess 90% of them would have had some form of OCD predating the religious content, whether that's checking or whether that's, having doubts about contamination, spending excessive time washing their hands. So I think for all of these patients, brothers and sisters, they need to get a formal assessment, because if you treat OCD, we have very effective treatment, both psychological through talking therapies, things like CBT, cognitive behavioral therapy, exposure and response prevention, plus medication, SSRIs we usually use. Once you get that person, if they need that treatment, then it's much easier for them to address kind of the religious content of their obsessions and compulsions. That's what I found. So even with this brother I mentioned, he's now on sertraline, and the sertraline has really reduced the intensity of his experiences, and now he's more able to access spiritual interventions to address, the scenarios you've explained.
So essentially what you're getting at, and I think is really powerful, is a very balanced approach to this whole thing, which is, okay, because you see this a lot. Sometimes there'll be some cultures or people from certain parts of the world that will see, okay, this is purely jinn, this is the supernatural, there's no such thing as mental health, right? And then we look at the opposite extreme, which is there is no jinn or the unseen or the metaphysical. It's all just mental health, stuff going on inside your brain, basically. But having that sort of balanced approach, I think, is very powerful, especially for Muslims. And I think the other thing you mentioned too, which is the balance. So yes, medication has a role to play, essentially what you're saying, especially in some cases where it's very extreme. And then when it sort of takes the edge off it, if you like, then you can start dealing with it and working through it, reversing it. Well, so what you're saying, another thing, just to clarify, are you saying that OCD, which would you say intrusive thoughts fall into OCD as well?
So it depends whether the intrusive thoughts are linked to compulsions or not. So people can experience intrusive thoughts without compulsions, right? Somebody who's severely depressed or severely anxious can experience intrusive thoughts, maybe around self-harm or suicide. So it's a broad spectrum. We need to kind of like dig down. So whether they meet the criteria for, say, OCD diagnosis or depression or anxiety. But intrusive thoughts can be part of a broader disorder, not necessarily only OCD.
Mhm. And just as I guess, side topic, why do you think there is such a stigma when it comes to mental health? I mean, physical health, we recognize it. Mental health is a real thing. Why is there such a stigma amongst many Muslim communities, even till today? People don't want to speak about it. If someone's suffering, they don't want to come out with it or talk to someone about it. Why do you think this is the case?
I think there's multiple factors. Probably it's considered stigma and taboo. Like, in the language in our families, Muslim families, you hardly hear people saying, "Oh, I'm suffering from anxiety or depression or low mood." Kind of culturally, it's not really seen as something, especially in men or boys, as something that we should be expressing our emotions. So emotional intelligence is an issue amongst Muslim families. Plus, also, there's a stigma around psychiatry being something alien to our culture. It's something that, the kuffar or the Westerners have imparted. And, Islam is the be all and end all, around psychological issues, because we can't see it. The example I give, Imran, is if you break your arm, if you fracture your arm, right? Making dua and praying, and it helps, but you're still going to go to an orthopedic surgeon and have your fracture fixed, right? So you can actually physically feel it and see it, say, on an x-ray. Whereas the mind, subhanAllah, it's so complex that the understanding of people is limited, right? Because we can do brain scans, but it doesn't show whether somebody has depression. Depression is a subjective experience. So in mental health, mental disorders, these are subjective experiences which need validation and treatment. But if they don't get validated from within the family or community, then that causes problems. I'll give you an example. So often we see South Asian aunties presenting with chest pain, right? So you do the ECG and you do the bloods, and everything's normal. When you dig deep, it's more of a somatic complaint. This is a common thing. So there's domestic violence, or there's some marital issues, social issues, which then manifest as chest pain. Because in our communities, to get help, you have to have some kind of physical manifestation. If somebody says, "Oh, I'm feeling depressed," it doesn't get validated. It just, so that's, I think, it's a learned response.
Very interesting. It's funny you mentioned that, because one of the areas I've been looking into recently is sort of, I think it's called neuroplastic pain syndromes that people experience. And I think what you meant, chest pain, back pain. Back pain is a very common one as well.
Headaches, migraines,
IBS, etc. All of these things. And a lot of times there's no physical, like you said, component to it, but it's psychosomatic, which is sort of mental or emotional trauma or pain that's held within the person, which expresses itself through the physical body. And it's a very real thing. And medicine is sort of starting to recognize that. There was a guy called Dr. Sano. He wrote several books on this back in the day, about 2 decades ago. And at the time he was ridiculed and no one really took him seriously, because people didn't see, if there's a pain in your back, then there has to be a physical cause. That's how it was understood. But that can be the case, but in some cases it may be psychosomatic once you've ruled everything else out. And I think that's another reason why people should, not see it as a taboo. We're humans, we're emotional creatures as well as spiritual creatures and physical beings. And sometimes, you may not have a physical problem, but you may be going through something emotionally, which is impacting your body and your being and your physiology. So it's important to get these things checked and treated as well, right?
100%. And there's even within our tradition. So if you look at the hadith or the seerah and in the Quran, there is references to psychological issues. For example, Yaqub alayhi salam, Allah subhanahu wa ta'ala describes him going blind through grief, right? So you could potentially hypothesize that he became so severely depressed that he had some kind of conversion disorder where he actually went blind through grief, right? Amal Huzn, the year of sadness, where the Prophet ﷺ, he lost his wife Khadija, he lost his grandfather and uncle, right? So even the Prophet ﷺ experienced states of sadness, right? So within and unfortunately our communities, they don't access this kind of information. I work within addiction. I know we're kind of like veering off. So there's Nu'man, I think he was one of the Sahaba. He had an issue with alcohol dependence. So there is actually authentic narrations about him suffering with alcohol dependence and how the Prophet ﷺ dealt with him. So within our tradition, there is a strong emphasis on mental health and mental well-being, you know. But unfortunately, there's lack of knowledge and lack of awareness.
So obviously, these things take time to change, these sort of perceptions and ideas within society. So I guess for people that are watching that are not currently comfortable going to, especially the brothers, right, the men who are not currently comfortable and don't see it as madly enough to seek out help from a specialist, is there anything you would advise them to do? Obviously, this is now someone that's resisting to go see a professional. Anything they could start doing for themselves? And I assume acknowledging what's happening is very important to start with, that you actually are experiencing, call it an emotional issue if you don't like mental health issue. You're going through a low phase, a difficult phase in your life. What could they start doing in their own lives to start helping themselves?
I think the first thing I would advise people is to go back to Allah subhanahu wa ta'ala. So I know it's kind of like a cliche answer, but look at and reflect on your association with Allah subhanahu wa ta'ala. Like, how strong is your salah? So often salah is a protective factor. If you look at the literature, even secular literature, they identify religion as a protective factor against suicidality, against mental disorders. So as Muslims, the first thing is, how strong is our connection with Allah subhanahu wa ta'ala? Are we regular in our salah? Is there an issue with, for example, riba? I've seen a lot of people who start experiencing challenging issues psychologically and mental health wise after they take a mortgage, for example. Or so there are, I always advise Muslims to reflect on their relationship with Allah subhanahu wa ta'ala and look at their weaknesses and work on those. So that's the first thing. The second thing is to actually speak about what you're experiencing. Speak to somebody that you trust, whether that's your friend, for the brothers, because maybe they don't feel comfortable speaking to their wife, or their siblings or their parents. But find someone that you can speak to. And mashallah, you guys are doing a lot of great work through the Lighthouse mentoring thing, so people feel comfortable to be able to verbalize what they're experiencing. So I think kind of normalizing that there are psychological issues which are affecting everyone, then that helps. So for that individual to actually find somebody that they trust, that they can speak to, and then go from there. And then I think over time, once you get validation and you don't feel judged or you don't feel like stigmatized, then people are more likely to seek expert help.
Yeah, very important. I mean, and that's why I think I've mentioned it before as well, but I'm sure everyone, yourself, doctor, as well, we've all gone through phases in our life where we've been, emotionally burnt out, and I've gone through phases of IBS and other somatic types stuff, and everyone goes through it. I mean, it's not that I'll be surprised to find someone that hasn't had some form of a breakdown or a low period in their life. But it's just a case of being okay with it and recognizing it like any other condition that you may have or may suffer from.
Exactly. Just to pick up on that, Imran, before I forget. So raising awareness is very important. So these kind of like discussions where people can access, somebody from a practicing background and understanding of mental health is really important. This is one of the reasons why I started my YouTube channel like a couple of years ago, to raise awareness. And mashallah, Gabriel Rahmani is doing brilliant work in raising awareness around mental health issues. So I think this is really important, raising awareness. Secondly, what you mentioned is really, I think, for example, now marital issues. A lot of both brothers and sisters, if you go into their childhood, they may have experienced something traumatic, okay? And that then affects their personality in a negative way. So we do have something called personality disorders within mental health classification. So somebody might be a narcissistic person, somebody like borderline or emotionally unstable, where they have, dysregulation of their emotions. They may be engaging in self-harming or self-sabotaging behavior. That can then spiral into marital conflict and end up in divorce. So having that understanding that, yes, we all come from, because obviously this life is a test, right? So Allah will test us in all aspects, including mental illness. And this is what Ustad Tim Humble tells people, is that sometimes the test will be a psychological issue. So this is important for us to recognize, especially now with high divorce rates in the Muslim community, is that people often come with baggage from their childhood. Maybe they've been sexually abused, maybe they've had some other traumatic experience which shapes their personality in a negative way. And if you don't have understanding of that, that can lead to disastrous consequences. We have something called transgenerational trauma. So for example, if I experience trauma as a kid, when I become a parent, that trauma can then be transmitted to my children, who then can transmit it to their children. So it becomes like a transgenerational trauma thing. So it's really, really important to recognize that and speak about it. We don't speak about these things, right? We kind of like hide it, or and people are now becoming more aware that this can have a very bad impact on society.
Yeah, no, absolutely. And it's an important topic. I don't think, like you said, it's not spoken about much, and I think more awareness needs to be raised.
Yeah.
So obviously there's childhood factors, growing up, environment, your social
Yeah.
interactions, etc.
Yeah.
One could even say that the world that we live in today, which is devoid of God, so a very secular, materialistic environment, has a profound impact on one's psyche as well. There's a very interesting book called Beyond Anxiety by Beck. Her name's Beck. I don't remember her first name. And one of the things she points out is that current neuroscience is suggesting that the sort of secular liberal world that's come to fruition after the Enlightenment has made people very sort of left hemisphere dominant. And that's the part of the brain which is also responsible for anxiety loops and so on. So people are having more issues, And what's really interesting is that, like you mentioned, people are obviously moving away from that type of atheism and naturalism towards new age spiritualities and new age religions, where it's like a mix and mash between different ideologies and worldviews, and a bit of Buddhism, a bit of atheism, a bit of spirituality. Have you noticed this phenomena? And do you think this is happening because of that sort of need to find meaning and spirituality that people have?
100%. I have noticed the shift, like you mentioned. I would say in the last kind of maybe 5 to 10 years, there's been this shift. So, and I think there's with everything, there's multiple factors. One of the things, mashallah, is that educated Muslims are in this field refuting atheism, and not just Muslims, but even other religious figures from a Christian background, for example. So I think that there's been pushback where historically, that I know when I was at uni, so I'm talking like early 2000s, there was nobody really in the field pushing back against atheism, the ideology. People used to talk without scientific basis or without authority, but mashallah, in the last kind of 10 years, a lot of brothers are coming in the field, like yourself, Muhammad Hijab, Hamza Zordis, very articulate and able to push back. So I think that's contributed to people who used to have I would say, be blinded by atheism, being challenged, which is, so today, subhanAllah, I just saw, I don't know if you saw this, there was a video that Sabur and John Fontaine put where he recorded.
Yes, I saw that last night. Yeah,
I couldn't stop laughing, subhanAllah. So, like,
that's a few years old, I think, that video.
I know it's a few years old, but I think he only showed it today or recently anyway.
That's fine, yeah.
Yeah. So the fact that people have the confidence and the knowledge to actually go into the lion's den and challenge, I think that's also resulted in a lot of people kind of doubting atheism. Secondly, I think the world is just spiraling out of control, and so much degeneracy that people are genuinely seeking answers, right? Historically, maybe they wouldn't have done that. And then obviously the wars, and subhanAllah, the hikmah around what's happening in Palestine, I've seen firsthand, I'm sure you have, where people who had no interest in religion have suddenly seen the resilience of, the brothers and sisters and kids in Palestine, how they deal with the trauma of the suffering and still remembering Allah subhanahu wa ta'ala, not blaming Allah. That has had such a powerful impact on the Western mindset. And so many people are turning towards Islam because of the way they're seeing real life events and how people are dealing with it from a religious perspective.
Absolutely, Doc. What's absolutely fascinating is, you could juxtapose, what happened in COVID in the West compared to what's happening in Palestine in some respects. COVID, what were we seeing? People are stealing toilet rolls, right? People are trying to empty the shelves, just, out just this fear of a potential which hasn't happened, but just this fear of, and apparently the rates of anxiety and depression went up during
Yeah.
COVID as well.
Yes.
Which they didn't really publicize too much, interestingly, but you could see that there was all these helplines that were popping up and so on. And I looked into this a bit, and there were some sort of, I don't know if they were peer reviewed, but some studies which were highlighting that, well, this is my summary of it, that people were cut off from their daily life. So we live in a very busy world. We're plugged in constantly, moving around, working. As soon as people were prevented from what they used to doing, and they had time to sit down and do nothing and reflect about life and the meaning of life, and they realized that there were no answers, whilst at the same time staring death in the face in the form of COVID, this virus, people started to lose their minds, right? Because they didn't know what to do with themselves or who they were, what they were doing it. So the world that we live in today, it's constructed in a way to keep us away from thinking about the bigger questions, the important questions. As soon as you're cut off from that, you're in trouble, right? So we saw that. And like you said, in Palestine, I mean, we see the response of the brothers and sisters. You know, they're losing their family, loved ones, children, and they have so much positivity and strength and resilience and reliance upon Allah, and they're smiling. This, like you said, this has moved people to their very cause. So it's absolutely true. Now, I want to sort of pick your brain a bit more in regards to what you think, or what you think the impact of the sort of modern secular liberal lifestyle has on mental health. We know you mentioned that religion, in particular Islam, has a positive bearing on mental health. And we've discussed briefly some of the reasons why that's the case, you know, because it gives us a better framework to understand reality. It's not only this life, there's the hereafter, there's Allah, we believe in Allah, this life is a trial, there's test, tribulations in being a test, etc. But what is it about the sort of secular liberal modern paradigm which increases mental health issues, would you say?
Yeah, I think this is well documented, well peer reviewed and published, that mental health, especially during COVID, you touched on it, increased. So rates of depression, anxiety, substance use, domestic violence, all of these kind of issues increased during COVID, and you've already articulated some of the reasons why. Now, in terms of like the secular liberal mindset, which is maximizing individual pleasure, right? Maximizing individual pleasure and really losing the concept of community and sacrifice. So everybody kind of, it's like the rat race. I want to make the most money. I want the most pleasure, hedonistic kind of lifestyle. That has contributed to isolation. So subhanallah, like when I see patients from a non-Muslim background or not irreligious background, let's say, they are very isolated. They're often living by themselves. Maybe they have limited contact with their families. They have maybe they'll see them once a year. And that isolation leads to depression and anxiety, and they try and fill that void by drugs and alcohol and, you know, sleeping around, etc. But that doesn't bring happiness. And so this kind of like liberal kind of lifestyle of individualization contributes to isolation, which then contributes to mental disorder and substance use. And I see that, like, I work with care of the elderly. So when you go to nursing homes, subhanallah, it's so depressing that when you sit with the elderly, and Islam teaches us to respect the elderly, right? When you ask them, like, when was the last time you saw your kids? They often say, like, last Christmas or maybe 2 years ago. So, you know, this kind of like individualized lifestyle and thinking only about yourself, or kids being asked to pay rent at the age of 16 when their parent, you know, if they're still living in their parents' house, it's kind of like cyclical issue. When they then become elderly, they get neglected by their you know, their children. And, you know, within mental health, within child development, the first 7 to 10 years are crucial for attachment, right? So kind of that secure attachment. We have attachment disorder. So people who have insecure attachment because they've not been able to have a nurturing, healing environment where they have a primary caregiver like their mother. In Islam, the mother has the, you know, a higher respect. So this then has an impact later on in life in terms of not having that connection with their siblings or with their parents, and then that leads to isolation. So I think that's kind of like what I've noticed with a lot of people from this liberal kind of mindset.
That's especially what you said about that connection with the mother and that nurturing environment in early age, and the significance of that in mental health in adults. And again, we know that's a common trait of the sort of secular liberal paradigm, which is, under the, whether you say the guise of feminism or whatever the case is, man has become the objective standard, the golden standard, and therefore, women aspire towards. And I find it very fascinating and strange at the same time. Why are you making men the standard, right? I mean, you have to do everything that the man can do, etc. And the way it affects children in the process, which is unfortunate, And the other thing you touched upon, which is loneliness, is a big issue right now, especially in the West. And I think that the liberal paradigm has something to do with that, because, like you said, individualism, it's like some say, liberalism is a way of life for the young, not the elderly. Because what is the elderly person going to do except be lonely and be left alone, which is a problem. So, Doc, just sort of spinning back around now to where we started off. And I think I want to get a bit more clarity on this from you as well. Sometimes what I've noticed is that people that are genuinely experiencing mental health issues, and that could be in the form of intrusive thoughts or anxiety, and maybe they're in a low phase. Sometimes they ascribe too much power to the jinn. And what I mean by that is, it's like, oh my God, I'm affected by, I can't do anything, I'm helpless. And then that psychology, that way of thinking, further negatively impacts them in a negative way. So it becomes a vicious cycle. What have you experienced this, and what advice do you give people that are going through this?
Yeah, again, excellent point you've made. People, especially in the Muslim community, they over attribute things to the unseen. So, okay, somebody had an accident, and it must be evil eye, it must be ayn. Somebody is going, somebody's having surgery because they have appendicitis, or is because somebody did black magic on me. So there is definitely, I've noticed, an over attribution and let's say a bias towards the unseen. So again, subhanAllah, Islam is the middle path. There has to be a balanced approach, right? So definitely in the South Asian community, less so in the Arab community, I've seen there's over attribution, and that's, I think, cultural, because a lot of our forefathers were Hindus, right? So within the Hindu culture, there is a lot of this kind of superstition, and so I think that kind of seeps into our culture and our religion, where people over attribute things. Definitely, I've observed that. And so it's, again, having a balanced approach. Not everything bad that happens to you has to have a cause. Obviously, if qadar Allah, but it doesn't mean that somebody's doing black magic on us or whatever, so I think that's definitely something that I see.
Yeah, no, absolutely. And even if the case is that, okay, there are jinn that are affecting you, let's assume that's the case. Even in those scenarios, you have to always remember that Allah is the creator of all things, not the jinn, right? So don't ascribe too much power to them. Turn back to Allah, ask Allah for help, seek refuge, and I guess have a more positive psychology when it comes to these things, where you're okay, even if that's the case, still Allah's given me the ability to seek refuge with Him and do the best I can, and not to overly make it negative for yourself.
Yeah, so it becomes learned helplessness. In psychology, we call it learned helplessness. So if you feel helpless, then it's a learned conditional response, which then expands into your other aspects of your life and kind of paralyzes you. So it's, again, cognitive reframing, cognitive restructuring, and understanding, yes, this is a test. As Muslims, for example, فَاسْأَلُوا أَهْلَ ذِكْرٍ كُنْتُمْ لَا تَعْلَمُونَ. If you don't know, seek expert opinion, expert help. So seeking help is also important, not just isolating and becoming helpless and externalizing. We call it externalizing what you're going through. You also have to internalize and look at the positivity. So Yusuf alayhi salam, he spent so many years in prison, but he used it as a positive experience, subhanAllah. So anything that we experience, there's khair in it. And I think just kind of thinking about that. Now, it's much harder to implement. Theoretically, yes, it's very easy, but to implement, it's more challenging. But just having these kind of discussions helps people. Just, I want to also touch on, sorry, I forgot to mention this. Sometimes there is, you've probably come across this, that, if you're a practicing Muslim, you can't suffer from a mental disorder. Yani, it's like, if you're a weak Muslim, and then you have these issues. This is completely false. So I've seen, subhanAllah, mashayikh who are hafid of Quran going through severe depression, right? To the point where they were suicidal and they needed medication and psychotherapy, and they recovered. So I'm talking about people whose iman, obviously Allah knows the heart, but objectively, they're at the peak in terms of elite, in terms of connection with Allah subhanahu wa ta'ala. But even then, they were suffering with severe depression and suicidal thoughts.
It's a very important point of that anyone can go through this. It's
anyone,
not just the case.
Anyone.
That if you're religious, that you should never experience. If anything, you're setting yourself up in a very negative way psychologically. That if you start practicing and then you say, I'm never going to become mentally ill, and that almost is a standard, and there's a level of fear that sets in. You're trying to always maintain that standard. That naturally you're going to suffer because of that. Because of that sort of pressure you're putting on yourself.
Because shaitan will attack you in different ways. And obviously, if you're, mashallah, a practicing person or a mashaykh, maybe it will be a psychological issue. And the other thing is, that then has an impact on their family. So I have seen people, religious people, who maybe their kids are going through some difficulty, doubts or substance use, or even depression. And because the parents are religious and have this false belief that psychological issues can't affect us, they then impact their children in a negative way, where they don't allow them to seek expert help and support, and so then they internalize these negative feelings, which may result in resentment, which may then result in rebellious behavior. So I have seen this quite a lot, which people don't actually see unless you're working in this field. Students of knowledge, mashayikh, some of them have real difficulty with families, like maybe their children or their daughters or whatever. So I think this, as a community, we need to be aware of this as well, that everybody's a human being and everybody can be tested with mental disorders or substance use issues.
Absolutely. And I guess the other thing you've also touched upon, which again is important to reiterate, is that one is acknowledging this stuff, the mental illness side of things, and seeing it as something real, and then looking for the right type of treatment for it and seeking it out and going for that treatment. But I think the other thing, the subtle point you've made throughout the whole session, this discussion, is also your mindset once you've acknowledged it. When you're going through it, it's a test, because a lot of people become disheartened and very negative and fearful of the whole thing. This is never going to end. I'm never going to get out of this. Why is Allah punishing me? Why me? The ego kicks in, that I shouldn't be going through this. And I think this is where the whole concept of submission to Allah also plays a role. That, yes, it's not comfortable. Yes, you don't like it. Yes, it's painful emotionally. Yes, it's draining. Yes, it has may have a physiological impact on your body, back pain, neck pain, whatever the case is. However bad it is, always remember that it's from Allah. It's a test, and it's not always going to stay the same. You will come out of it. So it's having that right mindset in the thick of it, of suffering, that's going to probably help you come out of it quicker as well. Am I correct in saying that?
100%. It's it's the mindset. There's multiple factors, but definitely it starts with the individual. So how do you see, and again, we go back to Palestine, if you put yourself in that situation, say you see all your children get slaughtered in front of you, and your wife and maybe your parents, you've lost 2 generations, but you're still able to see that this is the qadr of Allah, and you're still able to praise Allah subhanahu wa ta'ala and be patient. Now, from a perspective of what you're talking about, if you don't have that, then you won't be able to survive, right, in this world. You'll be like, why did Allah take all my children and my parents? I'm now isolated. Nobody's there to help me. What can I do? I'm in a miserable situation. So then it can spiral into severe depression and maybe even suicide. Okay. But then having that mind, and subhanAllah, that's why I think there's so much khair in what's happening, because people are seeing in real time how despite the worst circumstances, people still thank Allah subhanahu wa ta'ala and still have that connection with Allah, still pray their salah and still make dua, so that's a very important point you've highlighted, that mindset.
SubhanAllah. And so I guess the next thing I want to quickly ask you is, as they say, prevention is better than cure. That makes sense from the standpoint of physical health, normally as we understand it. But when it comes to mental health, are there sort of preventative steps you can take to develop your psyche in a way which is more resilient to mental health issues? And if so, what are they?
So 100%. So there are many strategies that you can do. First thing is, if you have children, making sure they have emotional intelligence, and showing them what compassion is. So unfortunately, a lot of parents, they're very, let's say, dictatorial in their parenting. So we work with parents in terms of parenting techniques. Now, there's no right and wrong. There are good strategies and bad strategies. So positive reinforcement, negative reinforcement. So when kids are even from birth, kind of creating an atmosphere where using the language of, okay, how are you feeling? How was, as they grow older, how was your day at school? Well, do you have any issues with anxiety? Is there any bullying? So kind of opening up that conversation within the family unit and then within the community. Having regular awareness in the community, say in the masjid, about talking about mental health, talking about the importance of recognizing if people are struggling from a psychological perspective, so that they can get early intervention. So that just having that general discussion about mental health, compassion, and also communication. So those families who communicate well have lower rates of mental disorder. So nowadays, as you know, digital addiction, behavioral addiction is a big issue. So if you sit down at the meal time, even if people do sit down, everybody's on their phone, right? Spending hours on their phone or their devices. This is very detrimental for development of children and also communication. If the kids don't feel, especially when they're younger, that you're present as a parent and you actually validate how they're feeling, that has a very detrimental effect on people, and that can lead to mental disorder in kids. Because how do they get your love and pleasure if you're always on your mobile or always out of the house, whatever? Spending quality time as a family, once a week, twice a week, going out without any devices and doing something active. Exercise is very important. So being a sports psychiatrist, exercise releases endorphins, which are natural antidepressants. So I think exercise is very important, not just for brothers, but for sisters and for kids. When we were younger, we're not saying that we're really old, but we were never in the house. I was always playing cricket, football. I played county cricket, county football, hockey. We were hardly in the house. But nowadays, kids are just isolated in their bedrooms, and you're in the same. I've seen, subhanAllah, Imran, I've seen families who communicate through WhatsApp. They're in the same house, and the husband is communicating with the wife. Okay, the dinner is ready, and then the mother is communicating and they're in the same house. So this issue around digital addiction is a big problem.
So are you saying that because we're sort of social creatures in a sense,
Yes.
we're created to be social, that having these devices and this technology is preventing us from socializing the way we're supposed to, which then causes issues? Is that the chain of events, if you like?
Yeah, that's one. And the other thing is dopamine, right? So for example, TikTok. So I think TikTok is one of the most evil things created, personally, because they've devised these short videos to give you dopamine bursts, right? And that's why people spend hours on watching short reels. But the problem is that when you get that dopamine surge, it doesn't satisfy you. So for example, if I love sports, if I go and play cricket or football, I enjoy that dopamine is satisfying. Whereas people, when they have digital addiction, which is really an issue, you get that 10-minute kind of burst, but it's not satisfying. Then you need another burst of dopamine and another burst. And so this dopamine kind of reliance is an issue. And that can affect people's mental health as well, because then you don't get instant gratification from an activity. That can lead to a downward spiral in terms of your personality development.
So this is a very big thing, especially social media is massive these days, right?
Yeah.
Everyone's on social media. And you can say that there's a hierarchy of social medias that, from bad to the worst possible. TikTok, probably, I agree with you, probably is the worst, because you're literally scrolling and getting these short hits. And you see in the Muslim community too, the type of content that's normally being consumed is short form, shorts and entertainment based, not knowledge based or long form content. And obviously that has one negative effect, which is people aren't learning anything and you're just constantly being entertained, which is unfortunate. But then you're saying that psychologically it can lead to mental health issues too, because you're getting you're wiring your mind or to be triggered from a dopamine perspective in a certain way. When you don't get that, then you go on a low, basically.
Yes.
How do people come out of this? What's the solution to this?
So the solution again, it depends on what the severity is. So if you have severe digital addiction, it's detoxing through. So we have clinics now, digital addiction clinics, where we work with patients and families, and we detox them. We can actually admit them and have a digital detox. The issue is that it's often more systemic and problems. So usually within the families, I recently came across a family where the young person, he was I think in his 20s, had an issue with digital. The family reported that he's always on his device or his mobile. When I took the history, subhanallah, there's 5 people in the house, and I counted the devices. There are more than 30 devices in the house, 30 devices, and they're spending at least 10 hours per day on their device. Every family member, the father, the mother, and the kids, and these are adult children, right? So this is the issue, and to come out of it, it's first of all recognizing that you have a problem, right? And then secondly, being motivated to seek help for it. So this is the thing. And also for development, like for example, if there's a lot of data now and research literature, for example, in Japan, where there's such a heavy reliance on kind of digital devices. So there are people, Imran, who don't leave the house for 7 days. They're just constantly isolated at home on playing gaming or on the internet. And now they have a big mental health issue because of loneliness and depression, because we are social. Allah created us as social beings. And subhanAllah, one of the benefits of going to the masjid 5 times a day is to develop that social relationship, in addition to the connection with Allah, but also the connection as an ummah. And that really is important. So within our families, having that time where we can communicate with each other without an external device is very important.
So that was the age of, or you could say we're moving even beyond that now. So we've gone from social media, where people are having these digital interactions with people, you could say aren't real interactions in person, which is a problem. But now you're going into the age of AI. How do you see that negatively further exacerbating the problem?
SubhanAllah, AI, this is another issue. So AI, I think, is going to be a big fitna for the world, and especially for the Muslim community. Already, I don't know if you came across it. There's a couple of cases where young Muslim boys killed themselves because they had like an AI girlfriend, and that AI girlfriend basically either gave the person. There's a couple of cases like this I read I think last year. Broke up with the boy, and he couldn't handle it, even though he knew it was an AI generated girl. And he ended up committing suicide. Moving forward, for example, in Japan and in China, now they're thinking of creating these pods, right? So if you have a mental health issue, you'll go and sit in a pod, and you have an AI doctor, and the AI doctor will diagnose you, and then give you the treatment recommendations. So if you can imagine somebody who's depressed and lonely, and they go and see a doctor who's also AI, so that you're losing that human connection, which will make loneliness and mental disorders even worse.
I didn't know that. That's mad. So the AI is the problem, and then the AI is going to try to fix it. But
exactly.
Acting like a doctor.
Yeah, and now with so also, sorry, you must have heard of these sex bots, kind of like, so these are now being promoted in the market. I think they're still going through the pilot phase. So you'll have like, you can create whatever you'd like in terms of the hair, the eyes, whatever, and then you're able to purchase it, and you can have sex with these robots, AI robots. So subhanallah. Yeah, so it's crazy. It's getting out of control.
Yeah, it's mad. It's because, you mentioned AI girlfriends. I've seen on forums. I sort of dove into this a little bit because I saw this as, on one side they say, oh, there's this narrative out there that AI is going to, like the Terminator narrative, AI is going to take over, it's going to destroy humanity. I don't see that as the problem. That's just some sci-fi fantasy. The real issue is those subtle changes that AI is creating within society. Like for example, from as simple as overusing ChatGPT to the point where you're not doing any work anymore, you're not engaging your cognitive faculties, and it's like use it or lose it, essentially, right? And you're not going to be able to, it's just like your body are trophies. If you don't exercise your muscles, so does your mind. And then there's the AI girlfriends. I've seen on forums where people are distraught because they felt vandalized by a sex bot, quote unquote sex bot. And it's crazy how how that interface between machine and human psyche, and how it's having such a negative impact on like these people. There was a movie and I'm not recommending anyone to watch this. Someone mentioned it to me where the actor has a relationship with an AI.
Yes.
And this was
Yeah,
before the whole.
I saw that. I saw that. Yeah, yeah, yeah. It was
Yeah, and
crazy.
it's crazy. That was before it all happened, and now we're seeing that coming into
Yeah,
fruition. It's actually
yeah.
taking place now. So
So yeah, the theme in that movie is actually the wife, she wanted the husband to buy this AI sex bot, and then he fell in love with her to the point where he then divorced his wife to spend time with this AI kind of sex bot. So this is the issue. The other thing is also very important, education. So there's been research recently where they've looked at kind of young adults in university. They did a trial. One group wrote with their pen and paper, and another group wrote on a digital device. And they found that the information retention was much, much higher for those individuals who are writing physically on a piece of paper. All right. So looking into the education sector, we're seeing a lot of young kids with concentration problems, ADHD, inattention, because of the overuse of iPads for learning. So there is scientific evidence for better cognitive faculties and information retention, memory processing when you actually physically write notes. Like when I was in school and university, we used to write notes and you highlight them. That helps expand your cognitive faculties. Now everything's done digitally, like you mentioned, ChatGPT. One of my sons, he's doing his A levels, and I always have this discussion with him that don't use kind of AI essay or ChatGPT, because like when we were in university, I don't know, I'm sure you did the same. Even now, you go to a library and you get a physical journal and you read it and you make notes. That experience is very important for your development. Now, if you just type into ChatGPT, can you generate an essay on X, Y, and Z, and it'll generate an essay for you. You can humanize it, and that's it. That's your learning.
yeah, it's scary how and I've fallen prey to this at times as well, where you do use ChatGPT for an exercise, something
Yeah.
simple, and then
Yeah.
you like push it a bit further, and then you
Yeah.
realize, hold on a second, wait, where is my hand in this whole process?
100%.
Like, and reading is very important. Most people don't read these days, right? And
100%.
I think. Do you think conditions like dementia, Alzheimer's are also going to increase in the near future because of tools like ChatGPT being misused?
I think that's one of the risks, because if you look at dementia research, one of the treatments is to engage the mind in, for example, puzzles or reading. That's a protective factor. So definitely you could hypothesize now, for example, the generation now, when they reach the older age, they may have high rates of dementia because they're not engaging different parts of their brain in terms of learning. So yeah, I think that's a potential risk, definitely. Definitely.
It's a crazy world that we live in, isn't it, Doc?
Yeah.
I mean, there's all this technology that surrounds us, and we know what to do. I guess most people intuitively know is always, overuse is not good for them. But it's like they're stuck in this whole process. So I guess to summarize and to conclude our discussion today, maybe give us like a list of 3 to 5 practical steps a Muslim or even a non-Muslim who's listening in can take to safeguard themselves, their mind, their psyche, their mental health, their cognitive, longevity, considering the world that we live in today.
Excellent. So number one is to make time for yourself. So mental well-being, whatever you enjoy, make time for yourself. So kind of self-compassion. Where all of us have responsibilities, family, kids, work, extracurricular. Mashallah, you're doing a lot of work. I do as well. But it's really important to take time out on a daily basis or a weekly basis for yourself and engage in some sort of wellness activity. So I like exercise. I love exercise. So daily, I'll have to do some exercise for at least an hour, whether that's on the treadmill, going for a walk, going whatever, swimming. So that's important. That leads to my second point: exercise. There's so much evidence for exercise being beneficial to your mental health and physical health, obviously, right? So I've done an exercise medicine course where we prescribe exercise. Okay, you don't have to go to the gym. Whatever exercise you enjoy, whether that's walking, playing a paddle, for example. Now paddle is becoming very popular. You can play, paddle, whatever you enjoy, but exercise is really important. Releases endorphins, which then lifts your mood and protects you from depression. Number three, obviously, as Muslims, which is actually the most important, is connection with spiritual connection. Having that spirituality, as you mentioned, the new atheism, like, people going towards Buddhism and all this kind of yoga and all this kind of thing. As Muslims, subhanAllah, Allah has given us a gift. 5 times a day we're able to connect with our Creator, and that time is very, very important for our physical and psychological well-being. Okay. Number 4 is communication. So communicating, not virtually, but having a face-to-face communication, whether that's with your family or whether that's with your friends. Definitely finding time, because I think in London, for example, I have friends who don't meet each other for months, whereas I maybe meet people geographically at a greater distance on a regular basis. So taking time out to social, because we're social beings, like we mentioned, so that social connection is very important. And number 5, focus on our children and on our youth in terms of being role models and also engaging them in outdoor activities and, making them well-rounded individuals.
Brilliant. What everything you mentioned there, subhanAllah, it's like if you look at the life of the Prophet ﷺ, it was actually incorporated every single one of those elements. Physically active, mentally active, spiritually active, socially active, all of those things were there. And those are all the elements that are starting to disappear from our lives these days, subhanAllah. So anyway, Doc, I'd love to have you on again. Maybe we could dive deeper into some of these topics
Inshallah.
In the future. But anything else you want to share with us before we wrap up today?
No, Jazakallah khair. I think we touched on, I like the discussion. It's very organic. So we were kind of like touching a lot of different aspects. But I think moving forward, maybe we can delve deeper into some of the research and some of the specific disorders. I would like to talk about addiction, because as an addiction psychiatrist, I'm seeing an epidemic of addiction issues in the Muslim community. Crystal meth. You might be interested, Imran. Maybe next time we'll talk about the link between crystal meth and accessing the unseen. So a lot of patients I see who are using crystal meth often report seeing jinn. Okay, I
have to ask you this before I go. Now that because that's one of the questions I wanted to ask and I completely forgot, because we veered off on all of these different tangents. But crystal meth, drugs, and psychedelics, and the link between them seeing these beings or entities. What's your understanding of what's going on? Is it that the drug or the substance is opening up a part of the brain, which is then opening up the part of the mind which can access these things? Or is it that, I don't know, is it just pure hallucinations that people are seeing? But that wouldn't explain the sort of common things people are witnessing across the world. Or is it something else? How do you explain it? What's your understanding of it?
It's very, very interesting. I think very in a brief way. So things like heroin, people who use heroin or opioids, they don't report these kind of experiences. People who are using, say, alcohol, they don't report these kind of experiences. What I've noticed from my clinical practice is, and now this is a big issue, is crystal meth, so methamphetamines or stimulants. And things like hallucinogens, ayahuasca. You might have seen stuff about ayahuasca in Latin America, people going and having this bad trip and reporting these really scary experiences. So I've seen a lot of patients using specifically crystal meth and reporting quite common experiences, even mentioning jinn and mentioning qareen. I had a very interesting experience where I was assessing a patient and he was telling me, right now my qareen is communicating with your qareen and telling me what you're thinking about me. Subhanallah. And the thing is, as psychiatrists, we're able to elicit whether somebody's having a hallucination in a sense of a mental disorder or whether there's something else going on. So I'm not sure, to be honest. I think this is an area of research. I was speaking to Sir Tim Hummel about this because he's come across this as well, that specifically methamphetamine, crystal meth, there's something that opens up the mind where people report seeing some jinn and these kind of like other beings.
It's very interesting. It's like almost like
Yeah.
Allah's created protective barriers,
Yeah.
you know, within our psyche and our minds that prevent us from accessing stuff in this worldly life, which is not going to be beneficial for us. Obviously, at the time of death, the veils are lifted as this, as in this thing. But it's almost like these drugs are almost temporarily lifting the veil in some way, which then is giving access to people to these strange.
Or alternatively, the other thing is also it could be like the other way that the unseen, the shayateen are attacking. I'm talking specifically about Muslims, where they are being encouraged to use these substances, and then when they're using these substances and they are intoxicated, they're making themselves apparent to them, and then causing them to have, you know, significant family dysfunction and psychological breakdown.
Wow. But this is the next episode, I guess. We're going to dive into this topic of addiction and drug use and how that may relate to the unseen. Why? Because a lot of Muslims are actually starting to think about, should I do this? Should I not do this? Should I engage in using these drugs, etc.? Have these trips? But I guess there's a dark side to all of this as well, which we'll discuss next time. But anyway, Dr. Abu Isa, may Allah bless you. Thank you for coming on. It's been enlightening. Learned a lot. It was a pleasure having you on and, you know, covering this very important topic. So hopefully everyone watching finds this beneficial. And just one last thing, where could people find you and your work, you know, once this goes out and they want to get in touch with you or whatever the case is?
Yeah, Jazakallah khair, Imran. It was my pleasure. Yeah, so I have a YouTube channel. It just is, if you just put Dr. Abu Isa, it'll come up. And I also have, I'm on X and Instagram as well. Not that active on those, but on my YouTube channel, all my contact details are there. You can, best way is to email me. There's an email address and I try and get back to people. But sometimes people get upset because it might take me a couple of weeks to get back to people. But as you can imagine, I have kids, I'm working, plus all this stuff happens in my spare time, so it's difficult, but I try and help as much as I can.
We'll put all those links in the description box. May Allah bless you.
Allah mami. And you.
Jazakallah khair.
Jazakallah khair. Wa alaikum assalam.